Now, moving on, still staying in the health sector, the Minister of Health, Kweku Agyeman-Menu, says Ghana has made significant strides in improving neonatal and maternal health care delivery in the country. Now, according to him, neonatal and maternal mortality cases have seen a decline from 29% to 24%, while all other maternal health care indicators saw positive outcomes. He was speaking at the opening ceremony of the 5th global meeting of the Network for Improving Quality Care for Maternal, Newborn and Child Health in Accra.
The Network for Improving Quality of Care for Maternal, Newborn and Child Health was formed in 2017 by 10 countries, supported by WHO, UNICEF and UNFPA, and in collaboration with other partners. The network brings global and regional coordination to quality of care for countries to share their best practices and to shore up changes through coordinated evidence-based actions and joint learning. At the opening ceremony of the 5th General Meeting of the Network, the Minister of Health indicated that Ghana has over the years put in place considerable effort in promoting maternal and newborn health care, which has resulted in increased coverage in maternal and newborn indicators.
Let me say that the past 2 to 3 decades has seen considerable efforts and investments in promoting maternal and newborn health in Ghana. This has resulted in increased coverage in maternal and newborn health indicators. ANC by skilled provider increased from 96% to 98%. Births occurring in the health facility increased from 54% to 79%. And births attended to by a skilled provider increased from 55% to 79%. Neonatal and infant mortality reduced from 29 to 25 and 50 to 37 per 1,000 live births, respectively. Despite this progress, Ghana's maternal mortality of 319 per 100,000 live births raises red flags for mothers and babies receiving care. Most of these deaths are preventable, and about 65% of them attributable to 4 causes: postpartum hemorrhage, hypertensive disorders, abortion, and sepsis.
The country representative for WHO Ghana, Dr. Francis Chisaka Kasolo, said over the 5-year period, all the network countries, including Ghana, have made great progress in strengthening the health system to provide quality care in general for mothers and children in particular.
Newborn and the child health. So in this program, what we seek to do is to improve the quality of care during, after pregnancies or delivery. So in this meeting, and linking it out with the Sustainable Development Goals, especially Sustainable Development Goal number 3, which calls upon for the improvement or attainment of universal health coverage, one of the areas is really to reduce the deaths amongst mothers that are delivering, as well as the children. So this meeting, by impacting skills to the different players at the different health facilities and the community, will contribute in reducing maternal mortality and child mortality, and in so doing, improve the chances of Ghana attaining the Sustainable Development Goal, and specifically attaining the Sustainable Development Goal number 3, which aims to improve universal health coverage.
Dr. Anshu Banerjee is the Acting Assistant Director General, Universal Health Coverage at the WHO, and he iterated the importance of the network.
On 3 messages why we are here. First of all, we know that for maternal newborn health, about 50% of mortality could be prevented if we would improve the quality of care. So that's the first key message, I think. Secondly, quality of care is also an equity issue. We know that in many health systems, the remote areas don't have enough human resources. They're the ones where the supply chain doesn't work. That's where data doesn't work. Let's say we're gathering data often is a problem. And so improving quality of care has a very strong component of also strengthening equity, bringing quality services to the last mile. The key objectives of the meeting are to see how we want to move forward. How do we want to strengthen the issue of quality of care within our work, and how do we also strengthen the role of the network moving forward in order to make sure that lessons can be shared and countries can learn from each other in order to improve the lives of mothers, women and children.
The 5th Global Meeting, which is ongoing in Accra, is aimed at sharing the success and shortfalls of participating countries in improving quality maternal and newborn health care. Prince Kwame Kuduga's report read to you.